Hi, my name is Bianca, and I'm a registered nurse on the Med-Surg floor here at South University Hospital. I am a member of the Quality Improvement Council, and I would like to talk to you about the National Database of Nursing Quality Indicators, also known as NDNQI. The NDNQI was established in 1998 as part of its Safety and Quality Initiative by the American Nurses Association. It is a database that provides evidence to examine relationships between nursing care and patient outcomes. Nursing Sensitive Quality Indicators uses technology and research to monitor the quality of care given and to establish guidelines on how to educate and enhance quality patient outcomes. The NDNQI reports quarterly and annually in an effort to build on the knowledge of what directly impacts the quality of nursing care, as stated by Post University. There are about 10 nursing sensitive quality indicators that are measured in the acute care setting. The prevalence of pressure ulcers in an acute care setting is the quality indicator I will focus on today. Pressure ulcers is a quality indicator that our hospital monitors very closely and reports back to the NDNQI. In this video, I will discuss pressure ulcers and how informatics is used to accurately trace and report the occurrence of pressure ulcers, whether the patient presented with one on admission or developed during their hospital visit. Pressure ulcers cause economic burden, human suffering, pain, and decreased health-related quality of life in patients. That was cited by Parasad in 2021. Pressure ulcers are preventable and negative outcomes from poor quality care. A pressure ulcer is damage to skin that usually covers a bony area that is caused by continuous pressure over an extended period. Pressure ulcers are staged as stage 1, stage 2, stage 3, stage 4, or unstageable. You all will complete a learning module that goes over pressure ulcers and how to stage them. If you ever have difficulty staging or classifying a pressure ulcer, you can always place a consult to wound care for assistance in assessing and evaluating a patient. The information needed for NDNQI will primarily be traced and monitored from documentation in the electronic medical record, also known as the EMR system. It is the role of every staff nurse to ensure they are documenting accurately regarding their pressure ulcer findings. Skin assessments are crucial on admission and any transition of care for every patient and must be completed and documented by 2 registered nurses. Documentation must always be thorough. The documentation allows the hospital to trace whether the pressure ulcer was developed prior to admission or during the patient's hospital visit. Pressure ulcers developed during the hospital stay is referred to as hospital acquired. Hospital acquired pressure ulcers lengthens the admission time for the patient and adds financial strain on the organization. Preventing and properly treating pressure ulcers will improve patient safety and the quality of care, as well as improve patient outcomes. A Braden assessment is also required documentation on every patient on admission and every shift. Braden assessments are used to determine the risk level for a patient developing a pressure ulcer. Determining the patient's risk level will help coordinate the care plan to implement and the interventions needed to help prevent the patients with a higher risk from developing a pressure ulcer. The nurse will be responsible for applying the appropriate interventions to implement. Interventions can include, but not limited to, turning and repositioning patients every 2 hours, use of a specialty mattress or padding, and improving nutrition by adding supplements. Repositioning of patients is an intervention to reduce the duration of magnitude of pressure over bony prominences. That was stated in an article by Gaspar in 2019. These interventions plus others are different technologies that the organization uses to improve quality care and decrease the prevalence of hospital acquired pressure ulcers. It is vital that every nurse is current on how to assess and document accurately regarding pressure ulcers. Performing thorough skin checks on admission and every shift is the first step to preventing pressure ulcers. A sign of an impending pressure ulcer is a blanchable redness on the skin that turns white when pressed. With proper repositioning and intervention, the blanchable area can be reversed if no other pressure is applied to the area and therefore prevents any pressure ulcer damage. Proper and accurate documentation allows for clinical specialists and educators to develop strategies to help avoid and or treat pressure ulcers. Collaboration amongst the healthcare team is necessary to help overcome the prevalence of hospital-acquired pressure ulcers. Pressure ulcers are preventable in most cases, and nursing staff knowledge is a key factor in successful pressure ulcer prevention, and that was stated in an article by Parasite in 2021. Nurses play a key role in preventing pressure ulcers by routine assessments and adequate documentation. Accurate documentation allows for our organization to accurately report to the NDNQI and receive current evidence-based recommendations and strategies. Missing skin checks and not properly documenting can make the hospital and nurse at fault for a newly found pressure ulcer. Adequate assessments and documentations in the EMR will aid in preventing pressure ulcers and improving quality care throughout the organization. Thank you for taking the time to listen.